Hi, my name is Isa Salinas Vargas, and this is my MHA599 Capstone Project Part 5 Implementation Plan. The service that I will be implementing for the organization is a mobile health clinic, and the goal for the program is to reduce the number of new cases of chlamydia, resulting in them to be lower than the California statistic as well as the national statistic. Right now, there is a widespread of chlamydia among our youth population and as well as our Hispanic and Black African American population here in Fresno County. One objective is to implement the mobile health clinic in the parking lot by the Department of Social Services 5 days a week every month, excluding national holidays. And the main reason is that we want to implement this program where there is a huge concentration of these marginalized populations. This will give medical care to those that are not yet receiving it for various reasons. The second objective is to increase insurance coverage among the marginalized population. Medi-Cal is the Medicaid for the state of California. We will also have Medi-Cal applications supplied by the Department of Social Services in these vehicles for the mobile health clinic. So that way patients can come receive services, apply for Medi-Cal. While they are applying for Medi-Cal, they will also be applying for retro Medi-Cal, meaning that Medi-Cal will pay for all of their costs and expenses that were from their medical services in the past 3 months from the application date. And if they have any questions about the Medi-Cal or the application, we'll refer them back to a county worker. In 2018, the Centers of Medicare and Medicaid Services grouped outcome measures into 7 categories, which were mortality, safety of care, readmission, and patient experience. And 22%, then patient experience, effectiveness of care, timeliness of care, and efficient use of medical imaging at 4%. The mobile health clinic will be using the quality measures focusing on mortality, readmission, safety of care outcome measures, effectiveness of care outcome measures, patient experience, timeliness of care, efficient use of care of equipment. For the mortality, it's the root of the organization. We're there to save lives. If there is a high mortality rate, then the CMS and public will see this. We will be rated low, and we won't have patients coming back, or they will be telling people to not be coming to receive services from us as well. Readmission, we want patients to be independent. We don't want them to be coming back over and over again. And readmissions actually will cost $25 to $45 billion on avoidable complications and unnecessary hospital readmissions. The safety of care outcome measures pertain to medical mistakes, and this can be infections and common safety of care outcome measures. Effectiveness of care outcome measures evaluate 2 things: compliance with best practice care guidelines and achieved outcomes. Lower readmission rates for heart failure patients is a great example of that. It's referenced by the Tinker article. Patient experience will make people come back or not. Patient-reported outcome measures fall within the patient experience outcome measure category, which assess the patient's experience and perception of their health care. The timeliness of care. This is what a lot of people will correlate their experience with, is their timeliness of care most of the time. Overcrowding of emergency department or other departments, as well as their inpatient programs, the length of day, increased costs of admitted patients. Timeliness of care plays a big part of the patient experience. Efficient use of equipment has to correlate with the sustainability and technological advances as well. Empathy. Empathy is a really big one here in healthcare. Empathy is when you put yourself in someone else's shoes. When we're dealing with patients that are suffering from STDs and STIs, it is very important that the staff practice empathy. And it's because the patient is being extremely vulnerable with us. They may have had sexual abuse, they may have had substance abuse issues, or they may have a fear of being judged for their sexual activity. No matter what they have gone through, we are here to help with their medical care. We must have equal parts of female and male staff so patients feel safe and comfortable. If a female patient comes in, they should be able to have a female physician, a female nurse, and a female medical assistant helping them along the way. Whatever the patient is going through, doesn't matter if they need to be referred for anything else, such as mental health services, psychiatric services, gynecological services. We will be able to provide them with those referrals and those resources to get those services. And another thing with empathy is that we need to be taking patient feedback seriously and implement those things to make their patient experience better. There will be a lot of risks with mobile health clinics to the organization, but it's very important to know how to mitigate those risks. With quality management, we must regulate staff training as well as development, standardized protocol. So it's important to have policies and procedures for when specific things happen, robust quality metrics, tracking, and performance feedback loops. With that, we can also be using what we had learned before from the previous slide, from patient experiences, as well as all of those other things to put into those quality metrics. Patient confidentiality is a big one. We must have strong access controls with unique usernames and passwords, data encryption, HIPAA compliance procedures, regular privacy training for staff as well. It's very easy to forget these things and to become lenient when we are out in the field. We may not have all that oversight as we do in the facility, so it is very important that we continue those practices out in the field. Safety, double checking medication, fall prevention protocols, inspection control measures, regular equipment maintenance, and incident reporting systems. When we are out in the field, it is also very important to ensure the safety of our employees as well as our patients. When it is very easy for things to happen and to go out of control when we're out in the field. It is a very uncontrolled environment. We don't have our HR with us. We don't have all of those nice essentials that we have in the facility. We may also encounter some people with unfavorable behaviors. We need to know how to mitigate those outcomes as well. For IT systems, we must have advanced firewall systems, regular data backups, strong password policies, employee security, awareness training, disaster recovery plans. With the passwords, we can have employees have specific guidelines to follow when they make their own password, as well as frequently changing their passwords, which could be every month or more frequent. And here in California, we're very famous for having earthquakes. We must know what to do when we have those natural disasters, when we may have extreme weathers, such as the extreme heat that we experience here, the extreme cold sometimes, and the harsh winters, the harsh rains, all of that. Patient records, standardized documentation practices, regular record review, quality control checks, electronic record management systems, and clear policies on record retention. And personnel management. The main thing is the effective employee scheduling. We need to ensure that staff take breaks and rotate with staff at the main facility to avoid burnout. Ensure proper certification and licensing is very important for personnel management. So, how will we ensure the organization's diversity, equity, and inclusion efforts? So, for the mobile health clinic, we're here to serve the marginalized populations. We must be able to represent these populations, various different backgrounds, various different ethnicities and races. To represent the diverse Fresno County population, we need to have staff be diverse. With transformational leadership, we can ensure this by having servant leadership, serving our employees and serving the patients. We need to have model inclusion for diverse backgrounds, promote a work environment of respect, host open discussion and listen to concerns, emphasize empathy with patients. The main things that the organization will market this mobile health clinic is through having posters at the Department of Social Services where we will be providing this service. We will also have posters at local emergency housing shelters, which has a huge marginalized population there. We will have a billboard in downtown Fresno by the biggest local hospital with the only level 1 trauma center here in the Central Valley from Sacramento all the way down to Bakersfield, and that is Community Regional Medical Center. We will have it posted on our social media platforms such as Instagram, X or Twitter, LinkedIn, Facebook. We will also have it posted on our main website, and it'll be spread by word of mouth. Word of mouth is extremely important and it can reach miles. It is what brings a lot of people together and can really make a big impact, especially if people do not have access to these other resources. And that is it. I hope you enjoyed. Thank you so much.